Good morning. This is Dr. David Mannino. I'm professor of medicine and public health at the University of Kentucky in Lexington, Kentucky, in the United States. I've been asked by the International Journal of COPD to spend the next few minutes talking to you about how patient and practitioner surveys have increased our knowledge with regards to the epidemiology of COPD. I've been recently part of a consortium of investigators from several countries around the world that have been looking at both patient surveys and practitioner surveys as we try to better understand COPD. Now, patient surveys have actually long been a part of the epidemiology of COPD. These have been done in virtually every country in the world in a number of different environments. Sometimes the surveys are actually done in person. More often the surveys may be done by other means, including telephonic-based surveys. There are certain advantages and disadvantages to these types of surveys. For example, a telephone-based survey can be relatively inexpensive, and that you can survey a large number of people. In fact, the largest telephone-based survey in the world is done in the United States, and it's called the BRFSS, which stands for Behavioral Risk Factor Surveillance System. And this is a survey that has long been the standard of other similar surveys done around the world. Of course, the world is changing rapidly. One of the challenges that, for example, that BRFSS now has is that many people in the United States, particularly younger people, no longer have landlines. They have cell phones. And this then creates other types of challenges, because in the past, for example, techniques such as random digit dialing would be specific to an area code. Now, at least in places like the US and perhaps other countries around the world, a person's area code may be completely unrelated to where they live. For example, I live in Kentucky. I have a daughter who has a Kentucky phone number, but she lives in Colorado. So that then provides different types of challenges. However, these types of surveys continue to remain an important way of determining relatively inexpensively burden of disease in the population. You can ask, for example, a series of simple questions and determine if a person's been diagnosed with a chronic respiratory disease. And this has long been the standard, for example, to determine the prevalence of diseases such as asthma and chronic obstructive pulmonary disease. And there are even challenges in that. For example, many people historically have not been familiar with the term COPD, or chronic obstructive pulmonary disease. So we would ask about other similar or diseases included in that rubric, such as emphysema or chronic bronchitis, although in recent surveys we're actually also asking about COPD. So for example, it's relatively easy to get the estimates of prevalence. Of course, one of the problems that occurs with this approach is that you can see prevalence that is based on people knowing that they've been diagnosed with the disease. It does nothing to look at, for example, undetected disease or people who may have an impairment in the absence of disease. Now, we have done other types of surveys where you actually go and physically test the people to determine whether they actually have presence of disease such as COPD or hypertension or diabetes. That's a different type of survey, and those surveys are always done in person. Another advantage of telephone-based surveys is that you can also target specific populations. For example, I've also been asked to quickly address practitioners. We can look at people who treat patients in various countries around the world, and this has been very instructive, particularly when you look at the difference between perception of patients and perception of practitioners. You can ask a practitioner, do you always ask your patients about their smoking status? And then you ask the same question of the patient. It's always impressive to me the difference that one can see between those two perceptions. There is recently, over the past year, in the International Journal of COP, a series of 3 papers that has come from this consortium that I mentioned earlier that look at both patient perceptions of disease, the burden of disease, perceptions amongst providers in different countries around the world. And then we have another paper that actually compares physician versus patient perspective. I hope you've enjoyed this brief introduction to surveys and how they have increased our knowledge of diseases such as chronic obstructive pulmonary disease. Thank you.